Joining me now is Dr. Kenneth Weeks of Novant Health. Dr. Weeks, thanks so much for your time.
Thank you.
Appreciate you being here. You have that interesting specialty combination of being a cardiologist and a sleep expert. We don't often think those two go hand in hand. Help us understand.
It is a little unusual, and it's related to the fact that in the early 90s, we started recognizing that heart patients and sleep apnea go together. And the overlapping combinations included hypertension, heart attacks, sudden death, coronary artery disease, depression, and a long list of features that go with being disrupted during the night. So we would see a patient with a heart attack and get everything tidied up in terms of risk factors, but the person would come back with another heart attack in 3 or 4 months, and it would surprise us enough so that we would have discussions and conversations about what are we missing. Obviously, we miss what's happening during the night. So unless a bed partner or a family member complains of having loud snoring in the bedroom, we might not know that that person is a sleep patient. So we started screening patients and asking those tough questions about their sleep habits and their noisiness in the bedroom. So we frequently would ask the bed partner to come with them on the visits and interrogate them basically about what's going on during the night. And then we would find the answers. When we started doing the research and got those answers and started screening patients for sleep apnea, we found a huge overlap of the number of people with truly dangerous obstructive sleep apnea also had the combination of heart attacks and strokes and atrial fib and the things that worry us with the heart.
So snoring can lead to heart attacks.
Absolutely.
And a lot of people don't think that's connected.
Well, it's fairly simple to explain. I think the way God intended for us to live is to breathe air in, which is mostly oxygen. And that oxygen provides the nutrients for our heart to function. The heart cannot work at all without plenty of oxygen. So it is bright red blood going through your bloodstream all night long. But if it turns blue because you're holding your breath, and usually the blue in the blue blood comes when the oxygen drops from the mid-90s, which is normal, down into the 70s, all of a sudden the body goes into what's called oxidative stress, and the organs and certainly the cells, all of the body scream as if there's an alarm bell going off. And that's when the body's cells start to clump together. Then they clump to the wall of an artery, and then they cause a little tiny blister on the inside of the artery wall. And then that sets up a drawing in of cholesterol molecules in the artery wall, and now a plaque forms. When the plaque forms, it then is very subject to rupture. And so if you're out chopping wood, or you're very upset, or you have an argument, and all of a sudden lots of adrenaline is pouring out, and the artery gets spastic, it will crack the plaque, and the plaque will rupture, spill its debris into the bloodstream, and that's a heart attack. No blood will go past that plaque that's ruptured. So the patient comes in with a heart attack, we take them to the cath lab, open up the artery, and they get better. Then the next morning start asking those tough questions about sleep habits because they go together.
And so much of that snoring starts because we're a little overweight. And you don't have to be a lot overweight for it to happen.
You do not have, no. And lots of my patients are thin and have sleep apnea to beat the band, and noisy in the bedroom and not overweight. In the United States, though, it's interesting that most of the issues are weight related. For example, if your body mass index is over 30, in general, you have it. If a female's neck size is greater than 17 inches, they have it almost always. If a male's neck size is greater than 16 to 17 inches, almost always you can say you need to be screened. And in fact, lots of companies require the patients go in to be screened and include a neck size assessment to see if it correlates with the possibility of sleep apnea. Then they ask the hard questions and screen those patients out and say you need to be tested.
And that's to really go through a sleep study, that
Right.
you're going to hook you up and try and ask you to sleep so that you guys can study and find out what's really going on.
And many patients consider that torture, but we do see the patients sleep well during the sleep study in the laboratory. It's not particularly dangerous or aggravating. They come in around 7:30, 8 at night. They sleep through the night. We monitor all the features, oxygen, rhythm of the heart on the EKG, whether they breathe through their mouth breathers. We check to see if they're kickers, if they kick during the night, which is also a treatable illness, and other features. We have a 15 or 20 characteristics of their sleep that we can put together in the morning and say, aha, Either you're okay to go or you've got a problem. Sit still and let's start working on treating your sleep apnea.
And so in addition to getting a better night's sleep, which we know that Americans are sleep sick and deprived of that, we can prevent heart attacks and some of these major issues in our health that nobody wants to have.
Absolutely. Sleep, in a way, is sort of the low-hanging fruit. All you have to do is ask a few questions, have an astute physician that's caring and has done a little reading or gone to some conferences about sleep apnea and heart disease, and they can help screen those patients and get them over to us, and we can make a difference.
Dr. Kenneth Weeks, thank you so much from Novant Health for sharing this important information with us.
Thank you.